Good morning, good afternoon, everybody. My name is Darryl Rowe. I am a Microsoft Teams technology specialist. I work in Microsoft Health and Life Sciences in the modern workplace team. I work with customers across the US, either provider or payer, pharmaceutical or medical manufacturing. So we're going to talk about Teams today, and Teams, you may have heard of it. It's the hub for teamwork, but you may be, not sure exactly what it does. You may be using it today and using it some of the capabilities. So you're probably aware that it's used for chat, being able to collaborate with people, for instance, via instant messaging and persistent chat. It also is a meetings platform, whether internal or external. So I can do video conferencing, web sharing across a number of organizations, internally or externally, including multi-party video. You may not be aware that Teams is also a telephony platform, so it could replace my telephone system. It could be my PBX. I can make phone calls through it. And lastly, it's also the access to Office 365 applications, so I can connect SharePoint to it, OneDrive to it, other Microsoft applications such as Planner or Microsoft Forms. Lastly, everything with Teams is wrapped around enterprise-grade security and compliance. So, for example, I can apply data loss prevention to Teams messaging. I can record meetings. I can look at transcription. It's tied into our existing framework. It supports single sign-on, multi-factor authentication, so it's a very secure application. So when we think about Teams, we think of it now really as a hub for teamwork, and it isn't just Microsoft applications. We can connect other things to that. You've probably seen some of the presentations around talking about the FHIR API and such like, but it does transform workplace collaboration, and I think of Teams as my single place to go where I work now. So I'm not going necessarily to the office. Teams is really my office that follows me around. I can use it also to streamline business processes. So I want to connect to a dashboard, such as Power BI. I can do things like that. Everything's in one place. And then lastly, I can share that work everything I'm doing across the whole organization. So whether it's mobile, PC, web, Mac, it's shared across everybody can use it. So Teams is, as again, the hub of Microsoft 365. It connects to other applications at Microsoft. It connects to Dynamics and Azure, Analytics, as well as Office. So whether it's content sharing through files, dashboarding, sharing CRM or customer records through Dynamics, or connecting to third-party applications through Azure, it can do all of those things as well. Before we get to deep dive into what Teams does for healthcare, just give you some idea on where Teams is. Teams is just over 3 years old now. It's actually just celebrated its birthday in March, and it's known as the fastest growing application at Microsoft. So it's used across all the industries, whether it's healthcare, education, financial services, or enterprise retail manufacturing, but it is a platform. It's used by 93 out of the top Fortune 100 companies. There's over 650 organizations that have more than 10,000 users. We're in 181 markets. And as to say about growth, since COVID and the lockdown, we've grown 60 times. So, 6,000%, if you think of it like that. In 1 week, we added 12 million users, and currently are running around about 75 million users across the world. Another metric we have is 200 million meeting participants. So if you're in the health and life sciences vertical, you're going to wonder, well, what's the point of that? How does it help me? So imagine you are a caregiver. It's just another application. You're thinking, right, what do I do with it? I've got all these other applications I already work with. So whether that's messaging or nurse call, EMR, meetings, consults, I don't want another application. What does Teams bring for me? So imagine this is your organization. You already have your own proprietary systems or your patient records, everything else in one place, but you also do interface to a number of other applications. Whether it's communication, you might have a messaging application. You've got the telephone system, probably a PBX somewhere. You also have a collaboration product. Maybe you have meetings with certain products out there. You've probably heard of Zoom and WebEx, for example. I might collaborate on files. I have other alerting things to do as well. I also have other portals. I might have wikis and knowledge boards. I have portals. The problem is all of these are disconnected. They don't necessarily talk to each other and they're not in one place. These are multiple applications. So for that caregiver that has to do their day job, they have to connect to all these different things. And then lastly, obviously, there's things such as paging. One thing that Teams does is it can bring the majority of those applications into one place, into one interface. I'm not going to multiple applications anymore, maybe going to 2 or 3 now. And Teams really is that collaboration and work hub. So Teams does have core functionality, as I described already. It has meetings, calling, video, chat, everything else. But it has to be secure. So we are a HIPAA High Trust certified product in Microsoft 365. Where we bring added value, though, is around for our first-line workers, where I'm maybe using a mobile device. I don't want to go back to multiple applications and PCs or carry something around with me. I need to have also applications that are connected in one place. So also using things like location sharing, people need to know where I am. I need to communicate things with Walkie-Talkie, such as that. I'm going to want advanced messaging. So, if someone sends me a message, I want to make sure that, one, that I got it, and 2, people know that I got that message. I need to have priority notifications. So here you can see some of the things we're replacing in the existing, discombobulated application space in a provider space. And then lastly, where does Teams, come in for some of the things such as virtual visit? Obviously now with things such as COVID, doctor consultations face-to-face, is not necessarily practical. So being able to connect virtually, also finding people or finding an expert, we still need to be very agile in this particular market. So today I'm going to talk about 3 things, primarily around what Teams can do for messaging, for care orchestration, and for virtual health. This is really just scratching the surface of what Teams can do. Teams has a lot of functionality, and think of Teams as a platform, not as a product. So let's talk about again, message somebody. They're not going to. Sorry, can you still hear me? I just got an echo back.
Yeah, now I can hear you. Yeah, you broke up a little bit, but nice and fine now.
Okay, great. Sorry about that. So healthcare messaging is one thing that we can do in Teams, where I can send out an urgent message. I can find somebody and they will get notified. It will persistently contact them, and they will, if it's an urgent, it will say every 30 seconds. If I don't respond, it will message me again. If that message isn't answered within a certain amount of time, it will go back to the sender and say, okay, that person's not available, find somebody else. So being agile and finding that person is very, very important. We don't want anybody to miss a message because it's life and death situations. Another thing that we can do as well, using again via virtual health, is maybe the doctor's not available or in a different place, but the caregiver's there that needs to ask a question. We have something such as image annotation. So with my smartphone, I can take a picture of the patient securely. It doesn't stay in the camera roll of the phone itself. It actually stays in the cloud. I can annotate the picture, share it with the other person, and they can give me some best advice on what to do next. And because it's stored in the cloud, it's part of that secure and compliant infrastructure that we have. And there's no way that it can be also shared in a third-party application outside of Teams or Microsoft 365. A challenge also exists is where you need to find somebody and you're not sure who to contact. So where do you find that expert? So we have something called role-based messaging. So instead of finding a person by name, I can actually search for a role that they're doing. So maybe it's someone in the EMR, someone in the something there that I don't know exactly who to contact. Maybe that role, their role changes and they change via shifts. Maybe they're different times of day. So I can actually search for a particular role, send a message to that person. Whoever's the on-call person will get the message. That said, if the person's not available, you don't want a message to go out into the ether and never come back. So there is also an option to delegate your messages. So for example, if I'm on vacation or I'm not unavailable, I can delegate my instant messages to somebody else. They can answer instead of me. And another thing where a lot of first-time workers, they do need to contact people via, such as through voice. They may be using other products to do that. We can actually do it through Teams as well. And we have a product called Walkie. Walkie is designed for mobile, and it's push to talk. So if you ever remember those push to talk devices, remember Nextel back in the day. With Walkie, it's using voice over IP. It's high quality voice, so know that that's static and all the other horrible noise you'd get in a walkie-talkie. I can now communicate in high quality audio across a certain group or a team of individuals that we're all working together on. We're also working with partners such as Samsung and Jabra, and they're bringing walkie-talkie specific devices out. So there is actually a Samsung phone, if you wanted to go down that path, a Galaxy phone that has a dedicated walkie-talkie button. I don't know if you can see that on the slide on the left-hand side. There's a little orange button that instead of connecting to Bixby and Samsung, it connects straight to walkie-talkie. Or there's a Teams button on that headset on the Blue Parrot device which take you straight into the walkie-talkie application and communicate through there. Another challenge of remote care is how do I work if someone is remote but I'm available, but I need to share with that expert. We've actually partnered with a company called RealWear. And RealWear is really a heads-up display. If you can see in the middle picture, it's a device that the person would wear, and there's a camera in the front, and they would actually go into whatever space they're going with. It's got and show that remote person what's going on in the actual emergency room, for example. That device also has such a thing such as a thermal camera. So if I'm looking at measuring COVID patients' temperatures, I can actually check that, and I can see on the screen it's giving me that temperature as well. That allows that remote person to see what the person in the room's seeing, annotate on there, and the person with the head-up display can see what's going on. So while it looks like a very, very small display on the headset, it appears to be almost like a 8-inch tablet floating in front of them, so they can see exactly what's going on. The device supports voice control. I don't even have to touch the device, so it can be sanitized as well. But I don't even have to touch. With voice control, connect to an expert to find out, to find the person that can show me what to do. So let's now move into the care coordination side of the house. So one of the challenges we had with one of our customers was around the Tumor board. So Tumor boards are used where there's an elevated requirement of care for certain patients, maybe cancer patients. They were kind of using a method of paper, whiteboarding, in-person meetings. The problem was people were doing like taking pictures of the whiteboard. It was very hard to share that information. Not everybody was available for an in-person meeting. So it wasn't really the best practice. They couldn't really, provide the best care available because they didn't have the technology to do that. So we worked with a customer in the Midwest, and using Teams and Microsoft 365 products such as SharePoint, Power BI, planner and forms, we brought all that Tumor board information into a digital workspace. It increased participation rates, so people could, join wherever they could from the meeting experience. They could share notes through Microsoft Whiteboard or through OneNote. It really did help them a great deal on providing a better level of care. And here's just an example of how they use that in Teams. This is actually a demo site, but here to give you an idea how that works. So we could collaborate in OneNote through Teams. You could use pictures, maybe it's through that annotation from a phone. We could share that content through a meeting. So we could have multiple people in a meeting. We could annotate through there and discuss that. Could be anywhere in the world. We can set up plans and tasks through the Planner app in Teams. That's the slide at the top. And lastly, we can measure that outcome through Power BI. So all of that things that used to live in a room on a whiteboard with post-it notes on now lives in a digital workspace that anyone can access from anywhere around the world. You've already heard today's discussion around EHR and EMR integration. This shows you that integration through Teams, and Teams does support either through the PC or the web app, but also through the mobile app. So I don't have to go to a PC every time I need to use this information. And here you can see it through the Teams mobile app and the mobile app experience. Shifts is a capability where we can actually assign people time on, time off. Again, it's another application, part of Microsoft 365, where it could have been a third-party application. People don't know if they're working on, working off, they're clocking in, clocking out. Shifts allows that through the mobile device or through the Teams application itself. I can schedule people, make them come in, they can clock in, clock out. I can track attendance with GPS, I can see where they are. So it's really a workforce management platform that is part of Microsoft 365 and Teams. We have one customer that is also using this for room management, so they don't necessarily have to assign it to a person. You could actually manage your meeting rooms, your patient rooms, everything else through the Shifts application. Another thing that we can do through Teams is assign tasks. So, for example, something may be happening, say there's a room needs to be cleaned or someone needs to be checked out. You can assign that task through Teams, through maybe through the PC app or the mobile app. And then again, that task is sent to the person that's logged into Teams. They can actually check in there, see what they have to do. It could be with a delegation as well, so maybe I need to delegate it to somebody else. And then that task is tracked. I don't have to go back to another device to tell you, hey, I've done that task. It's done straight away through the mobile app. So virtual consulting. So as I've already explained, Teams has a great voice and video capabilities. I can use it for my internal meetings, through my telephony, for external meetings, everything else. We also bring that out to our external parties as well, and you can use it as a telehealth solution. So using the intelligence of Teams and being able to share content through a channel or through a team, I can actually collaborate together, not just internally, but externally with my patients and with my customers. And with the Teams application, I don't need to have a download, a plugin. I can actually run this through the web or through a mobile app, and I can communicate through to my patients and share history with them, or they can share video and things such as that. You've probably already seen this slide because I think Eden presented it about 20 minutes ago, but just to reiterate some of the use cases for Teams, whether it's virtual rounding, patient care. We even had, during COVID, we also had patient to family communications as well, where patients couldn't see their family because of contamination. They were actually contacting their family through Teams on their side and Skype Consumer on the on the family side. So virtual consults is something 65 in Teams, and it's using something called the Microsoft Bookings application. So here I can, as a patient, schedule an application via an external facing website. I can go in there, I can say I need to, say, for example, attend a physical. I can select the date and the availability of when I'm available. And if I wanted to pick a certain caregiver or a doctor, I can do that too, or find the next available person. When I schedule that time, I will get an email and an SMS reminder. And then at the time of the schedule, I can just join the meeting or the consultation through the web. I just go into my browser, no plugins required. It opens it directly into the consultation. The same on the other side for the caregiver; they can actually do the same as well. And it really just shows you just more around how that on the provider side, what the patient virtual visit looks like. Once that patient has scheduled that time, it appears in my Teams calendar. You'll see there. I just have to log into the actual appropriate meeting. On the patient side, again, seamless join. They just need to log in via a browser or use a mobile app. They don't need to log in with an account. They just go straight in as a guest. They'll sit in a virtual waiting room, so that they won't overlap into somebody else's consultation, which would be really challenging. But they can also have share, chat, voice, video, and sharing. So I could share a record or a recommendation with my patient. And then on the provider side, when the patient does arrive in the room, so I'm running a little bit late, I'll get a notification saying they're there waiting for me. I can just log in with either my PC, web client, or mobile device and communicate with that patient. So just to wrap this up, Teams is designed really to provide better care for your patients and your customers. It's designed for speed, for agility, for to take account where we are with things such as COVID and being able to communicate virtually. And also, it provides a single interface to a lot of applications that were disconnected before. So using Teams as my one interface to talk to my EHR, to my meetings, to my consultations, and can now do that in one place. And if you'd like to know more, we actually do have a modern workplace blog. I think you can share this at the end of the webinar, but if you go to aka.ms/HLS blog, you'll see a thriving community where we share a lot of information around what's new in modern workplace and healthcare. But also, you'll see some of the other content we can do around Teams or Microsoft 365. And with that, that's my presentation.